All right, so we are done with the quiz. We are going to start our next chapter. It's chapter 16, vital signs. So these will be, going to break them down. So there's kind of 2 PowerPoints today. The first one is like an introduction to all the vital signs. The second one is more just on temperature and pulse. And that is what we are going to focus on today, our temperature and our pulse. So I'm going to tell you a lot of facts about them. And we'll get up and we'll do an activity related to that, and then I'll show you all those skills, okay? So our objectives are up here, right? You have to be able to tell me 5 vital signs, which you probably already know them. You have to know how to record them. You have to know some of the terms that go along with it, and then what normal ranges are. And we'll go over all of that. So our vital signs, right? These are basically what tell us how our body is doing. So if you're sick, if you're not feeling good, we take your vital signs, right? When you tell someone you don't feel good, what's one of the first things they do in a hospital? They check your temperature, they check your blood pressure, they check your breathing, they go from those things. So basically there are, this one says 4, but there's really 5 now, right? So there's temperature, there's pulse, there's respirations, there's our blood pressure, and then the 5th one, anybody know it? What's another thing they ask you when they're asking you when they're doing all those things? Are you having any pain? So pain has become our 5th vital sign in the last couple of years because pain is a big thing for our patients. With pulse, there's 2 kinds of pulses. There's the pulse I can feel on your wrist, and then there's an apical pulse, which is what I listen to with the stethoscope. And we're going to do both kinds, and I'll show you all of those things. Right, there's our 5th one, the vital sign. So some other assessments that you can do, right? You're going to ask them, are they having pain? What else can you ask them about pain? Rate your pain. So if I can tell you from 0 to 10, and in all of your eyes, 1 or 0 is no pain, right? 10 is the most pain. So if I stubbed my toe right now, what would all of you rate that as? Maybe. Everybody has a different pain level. So remember how we talked about subjective and objective data, right? Pain is a what kind of data? Subjective or objective? Subjective, because it's what my patient tells me. So remember how I told you patients, you'll go in, they're laughing, they're giggling, they're on their cell phone, they're texting. You ask them how much pain are you having, and they say a 10. You're not the one to judge what a 10 is, right? Yeah. Even though you will judge, but you're not supposed to. You're supposed to just go, oh, okay, and dose them the medication based off of that rate. You can look at the color of their skin. So when someone's sick, are they a little paler? They just look kind of sick, right? You can tell that. They look like a pale color. Their pupils, so over here on one of my mannequins, a couple of you have already noticed one eye is like small and one eye is like big. Your pupils dilate based off of if you're sick, if you're doing drugs, if you're dying. Your eyes react to a lot of things depending on what's going on with your body. So it's another thing that we look at when we are checking our patients.
It's down low.
So this is kind of a pain thing. I know it went down low, didn't it? It's just saying it relaxed to light though. Another thing, what if I have a patient that can't tell me 0 to 10 of a pain? Like they can't talk. How would I know if they're having pain? Their hands, their face, their grunting maybe. Another thing is, you remember how I told you we could like show them pictures and they can point to them? So in the back chart back there on that sim center, there's like a green and then like a pink face and then it goes red, right? So red means I'm really hurting. Green means I'm happy and fine. So you can show them those faces. They can kind of make those decisions. If anything is abnormal, who do we tell it to? Doctor or the nurse, right? You should tell everything to the nurse if they're abnormal for any reason. And we're going to go over what normal levels are so that way you would know what was abnormal. Anything that's different. If my temperature is normally 96 degrees every morning and today I'm 98. Is something wrong with me? Maybe something's happening. Maybe not though, but it's something that needs to be reported so we can start observing the patient for things that could be happening. If I go in to take a temperature and it doesn't read the first time and it doesn't read the second time, probably something is wrong, like majorly wrong. So we have to report whenever we can't get something. The biggest thing you're not going to be able to get is probably a blood pressure. If the patient is really sick, the blood pressure can be so high that it's hard to read, or it can be so low that it's hard to read. So that could be something that the nurse is going to have to come in and help you do, or maybe she can't find it either. So if you can't read it, you have to let her know. And then never ever guess. So sometimes they give you like 15 vitals to go get, and you don't want to wake the patient, or you just don't feel like doing it, right? We all know people like that. And they'll just guess, like, oh, their temperature was 98, and pulse was 62, right? They'll just start guessing numbers, but that's not accurate, and that's also false documentation, so you can go to jail for that, and you can lose your license. So all bad things. So let's just talk about temperature. What do you guys know about temperature already? Anything? If it's 104 above, it's a fever. Okay. What else do you know? That's it?
Whatever you said to Lakin.
I said to Lakin that if it's 104 or above, you can start having seizures. And at 106, your brain will start frying to where you can go into a coma, right? So your temperature controls a lot of things with your body. So first, it tells us if our body is producing heat or if our body is losing heat, right? Where do we lose the most heat out through our body? Our head. So when babies are born, what do we do with them? We put hats on them to keep them warm, right? That's why we put hats on babies. Your heat is lost to the top of your head. So we try to figure out if you're losing heat or if you're gaining heat. If you're gaining heat, we try and put cool things on you like ice to get you to release. There's no binders down there? Oh, goodness. Okay. Your heat is produced by the food that you're eating. It's produced by the movement that you're doing, your muscles. So if I have more muscle mass or more fat on my body, I stay warmer than somebody who doesn't have much of that, right? You guys ever notice, right? Little people are always cold. Bigger people are always like, man, it's hot in here. Yeah, okay? That's because they have more muscle mass, more fat on their body. It's keeping them better insulated. And then, how do we cool our own bodies down? If I was hot, what would my body start doing? Sweating, right? It would tell me to get something to drink. It would do things to cool my body down. Those are basically things it would do. And then, what about if I'm too cold, what will my body do? Give me shivers to try and warm me up. What else does it do? Gives me the chill bones to try and get the hair off my arm to start like poking together, to start friction, to get some heat on my body. And it also tells you to start rubbing your arms, right? Because you're trying to get something done. So, where can we measure your temperature? My mouth, my underarm, my bottom, my rectum, right? My ear, my temporal is my forehead, which is what we're doing right now, right? The touchless one. So your mouth, we call that oral, right? Your oral, because that's the name for that's the medical term for your mouth. And then the most accurate way to get a temperature. If you have a fever in your mouth, like if your mouth, we take your temperature and you have a fever, and then we take a different way, let's say your ear, your forehead, and you have a fever. If I'm going to call a doctor as a nurse, he doesn't care about any of these ways except for the rectum. He's going to ask me, did you take a rectal temperature? Because a true temperature would be the same in your rectal. Yeah? So obviously none of you have ever had your temperature taken in your rectum.
When you're a baby,
When you're a baby, that's where we take temperatures. But none of you remember that, I'm sure. So I've had to take lots of temperatures in the rectum. Patients don't even, it's not noticeable. Trust me, it's not noticeable. Okay?
How do they not know?
I mean, they know I'm doing it, but it's not like it hurts. Like,
Oh, okay.
No.
so I'm just gonna show you. Okay, so here's a regular thermometer that I would check with their rectal. Okay, and it's not like I put this whole thing in, right? It's really this little section right here goes in. So that's what, an inch? Y'all are looking at me like, no, ain't nothing going in. Okay, it's an inch, and how wide is this? It's super tiny, right? So we put a cover on it, and I'll show you how to do those. We put a cover on it. We put some gel on it because we're going in a hole that's made for an exit, right? So we want it to be gentle. So we put gel on it, and we put it in probably like this far. That's barely even an inch. It's probably like half an inch. And then we wait for it to beep, right? And they're on their side. They're like, kind of in like the fetal position. They're over on their side. They're turned over, and you just got this in their rectum.
And you just wait for it to be.
And you just wait for it to beep. And if they have a fever, then yes, they have a true fever. If it's not as warm as what it was in the oral, there's something, it's not always a true fever then there's something else going on. Maybe they just had a hot coffee, or maybe they just haven't opened their mouth in a long time. Because if you don't open your mouth in a long time, you ever just then opened your mouth and now you got hot breath, right? That's just the heat coming off of your mouth, and that happens with a thermometer too. And then armpit, you guys obviously know, right? Goes under the armpit. Okay, I'm not gonna go over the rest because I think you guys got it. How many of you know how to convert Celsius to Fahrenheit? Do we even take temperature in Celsius anymore? Not really. Back in the day they used to, but we really don't do it anymore, so I'm not going to worry about it. If you ever had to convert from Celsius to Fahrenheit, what would you do? You would ask somebody or you would Google it, right? And it will tell you exactly how to do it, how to convert. I'm not going to worry about it because, like I said, most things these days are in Fahrenheit. They're not even in Celsius anymore. We used to do thermometers in the mercury where the little red line would, as it heated up. We still do it in science classes, but that's pretty much it. We don't do it for the body anymore. Is my temperature different in the morning than what it is at night? Probably, right? So depending on the time of day, my temperature is different. I can tell you at my kids' daycare, I have to get my temperature taken when I go in the morning. I'm 96.7 every morning, like religiously every morning for the past 5 weeks. But in the afternoons, when I get there, I'm like 99 and 100 when I get there. Every day I thought I've had the corona for some weird reason. I don't know why I'm so hot in the afternoons. I'm assuming it's because the sun is beating down on me as I'm driving, right? But I don't know. So those are things to take into effect when we are checking someone's temperature. Or where you're taking it, basically. So,
No, we just talking about something else.
yeah, I know. So it's not what we're supposed to be doing, though, aren't we? We're supposed to be listening to about the temperatures. So this is how you would take an oral temperature, right? It's measured in the mouth, okay? You place it in there for 3 to 5 minutes, or until the machine beeps. So these ones are a little bit longer. These ones probably take the 3 to 5 minutes, but it like beeps when it's finally done. It like does a beep, right? And then these ones you see more in the hospitals. They're a little bit faster. They probably take like 30 seconds to put these in, and they beep too when they're done. And then you've seen the ones in the forehead ones that they're taking every morning, right? They beep when it's checks your temperature, and they take like 3 seconds. Which one's more accurate, you think? Probably my 3 to 5 minute one, because it's actually checking how the temperature is in your mouth, not just blowing it around. So our normal is 98.6, but not everyone is 98.6. So we always go off of this range. So 97.6 to 99.6 is basically our range. So how many of you thought 99 was a temperature, like a fever? Right? But that's not really a fever, is it? Not in the mouth. It's pretty typical to be that long. These are the most common, they're most convenient, most comfortable. We put them underneath the tongue, right? You don't just put them in their mouth. You guys have all had your temperature taken. They told you to lift your tongue, put it in there, okay? We usually ask our patient, have you had anything to eat or drink, or have you smoked in the last 15 minutes? Do any of those things matter? Yes, so smoking, eating, and drinking will alter your temperature. It can lower it or raise it depending on what it is you've done. So if they have had any of those things, we wait 15 minutes and recheck their temperature. Here's the rectal, right? Here's my picture where they're on their side and we're putting it in. So we hold these the same thing.
Is that a butthole?
It is a butthole, that's the rectum.
The cheek.
You gotta get to the butthole.
We gotta spread the cheek.
You're gonna have to spread the cheek to get to the butthole, okay?
Hold it there for like 5 minutes.
She got gloves on, right?
She's got gloves on, yeah, she's got gloves on,
Am I
okay.
sterilized gloves?
You just wear regular gloves, just standard gloves. So same thing, you're gonna hold it in place for 3 to 5 minutes. The big thing about this one is how many of you have ever had a nurse that put it in your mouth and let you hold it or like just let it hang there, right? And that's okay, it's not a big deal. This one, you're not gonna wanna let it just sit there. You're gonna have to hold it because the body instantly wants to start pushing things out, it'll just fall right back out. So you have to hold it in place while it's in there. And a normal temperature in the rectum is 99.6. So we say our range is 98.6 to 100.6. So really in the rectum at 100 degrees, you don't even have a fever yet. Right? It's the most accurate, it's an internal measurement. It's not just my mouth and my head and all of that. It's literally what my organ temperatures are and everything based off of my rectum. We usually use this on small children, but it's also on people who are very sick and we're not getting good temperatures on them, or if we truly want to know if they have a fever. I don't know why some of these are showing lower, but they are. The axillary is my armpit, right? Not done as frequently. Why would we even do the armpit? Any?
Oh.
What if my jaw got broken and I sewed it together and now I can't open my mouth? How would you take my temperature? Rectally every time? You would take my armpit, right? Makes more sense. That way you don't have to go to my booty every time you want my temperature every 4 hours.
Or like, it's like, you know, deaf people, they don't have tongues, I don't think, so like, they could do it on their own.
Who don't have tongues?
I forgot, some people don't have tongues.
Some people have like a clip or something.
Excuse
Oh,
me, interruption.
hold on,
Has
Mr.
Mr.
Campbell's
Williams
back.
showed up to class yet?
No, he has not.
Thank you.
Thank you.
What if that's him at the door? That is him at the door. I just said, thank you. Mr. Campbell very good. Yes. So Mr. Campbell started knocking on the door like the police.
I know. I was like, what is that doing? You should have just came in. That's all right. So, do the armpit. We can also do the groin. So, right in here is your groin, where your thigh meets your like torso. So you can take someone's temperature in between the two folds there, right? So that's kind of like your armpit. It's just where skin on skin meets each other. Not the most accurate way to take a temperature, but still doable. So normal is 97.6, range 96.6 to 98.6. So are you seeing how they all kind of vary a little bit? Okay. And then this is the least accurate, obviously, because it's just between two pieces of like skin. The ear. Any of you ever had your ear temperature taken?
Yes.
Yeah.
Yeah? Okay, have they ever just put it right in your ear and took your temperature, or do they pull your ear back?
No.
Yeah.
So they're supposed to pull your ear back and up for an adult to get the probe down in there really well to get your actual temperature. 9 times out of 10, we don't touch the ear, we just put it in your ear, right? And they're the same thing, they're not as accurate. Earwax can be in the way. They read a lot faster, but they're, like I said, a little more inaccurate because how many of you clean out your ears every day? I don't know. Everybody does. You would assume everyone would, but not everybody does. So there's earwax in the way. There's people who have to go in and get earwax removed from their ears with pliers. So all kinds of things can happen. This is an old school tympanic one. They've obviously come out with brand new ones that are a little more fancier looking. The ones that we've got, like they look like a little gun on your forehead, right? That's what the school's using. But these you run, either you can run them across your forehead and actually touch the forehead, and there's some that scan in front of the forehead and give you a temperature. We do these for a lot of babies, and then obviously now we do them because we don't want to be touching and cleaning and changing every thermometer in between each person that we're checking the temperature on. So, why does my temperature go up? If I'm sick,
If you're like hot or something.
if I'm hot, like I've been doing exercising,
It's just your body reacting.
it's just your body reacting to something, right? How about if you're excited? Do you think your temperature is more elevated? If you're excited? Maybe it's just hot outside, so your body temperature goes up. Okay? Why does my body decrease?
It's cold outside.
It's cold outside. I'm cold because of the environment. I'm sick. I'm dying. Right? I'm starving myself. Starvation. Remember how I told you how muscles and the body mass gives you heat? If you're starving your body and you're like wasting away, you're getting colder and colder. When you're asleep, your body temperature goes down. Any of you got real sleepy and then you're like, oh, it's cold in here, I need a blanket? It's because your body is cooling down to start relaxing to go to sleep. Anybody a mouth breather? Or you guys all nose breathers? Nose breathers?
If I'm sick.
I become more of a mouth breather when I'm in this mask for some reason. I don't know. I feel like my mouth's more open when I'm in the mask. We talked about cold, temperatures. So abnormal, right? Hypothermia. Anybody heard of that before?
Ain't that when you're too cold?
When I'm too cold, right? Too cold, below 95 degrees. So usually people start dying or start becoming frozen at under 93. So as someone is dying, their body temperature starts decreasing. Too much under 90, they've probably already passed away. So anybody that's interested in forensic science, which I know one of you is, right? This is how they can tell when someone has died, based off of their body temperature. Like they just found someone in the park, right? They would check their body temperature, and based if they're 70 degrees or 80 degrees, is how fast or how many hours ago they were murdered
So like,
or killed.
if it's a body, it's like 94, are they dead?
If it's 94, they are probably dead, yes. And you could know that because typically if they were killed at a normal body temperature of 98 and they're 94, they're 4 degrees less, and we usually lose a degree every half hour. So you probably were murdered 2 hours ago, roughly. And then they also can tell things by like the growth of bugs and stuff on you. Like that's also another, we'll get into that. Trust me, we'll get into it. Okay? A fever, or we call it pyrexia, okay? It's elevated body temperature. It's anything over 101, just a fever, right? Can be usually from an infection or because we have an injury. We say febrile or afebrile. So febrile means they have a fever. Afebrile means they're without fever. So A means without, febrile is the fever. Hyperthermia is the opposite of hypo. They're too hot. Yep. So things that change it: eating, drinking, depending if it's hot or cold, smoking, and then changes in the condition of the environment. Yes. These are basically like thermometers again, showing you how to read them. Most thermometers are not, these are old school mercury ones where you had to read the notches. I'm not going to worry about the notches for thermometer. When we get to blood pressure, I'll show you that because it really, that's where you're going to have to need it. So mercury was the glass thermometers. Did anybody ever see those before? Yeah. Right? If you drop them, you have to clean up the mercury. You have to use your gloves and glass and all of that. Here's different kinds of thermometers. This one, it's a plastic disposable one, kind of like a pregnancy test. So you put it on your forehead, and then it like reads how many dots are on it. It tells you how many degrees you are. So every single time that you put it on your forehead, it reads like 1 degree, another degree, all the way up to 90. Yes, I can. Are they the Mr. Martin's binder things? Thank you. And then when we record a temperature, if we take it orally, you just write down the temperature. But if I'm taking it through the rectum or through the armpit or the temporal, I have to put a symbol behind it so they know where I took that temperature. So if it was rectal, I put the R. I didn't see him at first, and then by the time he got in here, it was kind of too late. So I was like, So rectal is R, auxiliary is AX, temporal is T. Right? Pretty easy. What's it start with is what we put behind it. Cleaning them. If I was just using a regular thermometer, we just use an alcohol pad, wipe them down. There's nothing major. We do have covers for them all, so that's a big thing. So how many of you think you know how to take temperature? Yeah? Okay. You guys are like really sleepy here, so I'm trying to make sure you're all awake.
Is your scanner thing working?
My scanner thing working? No. He's supposed to be coming to fix it, but he said he's like 100 people behind, so he'll get to me when he gets to me, because it's not an emergency, which makes sense. There's probably other things more important than my printer. So, okay. We are going to talk about respirations now. I'll try and do it quickly, then I'll show you the skills. Okay? So respirations, it's all about your breathing. Breathing in, breathing out, right? We breathe in O2, oxygen. We breathe out CO2, carbon dioxide. Trees breathe in the opposite, right? We need trees to live. They need us. Did you guys know that? No? You guys are real cheery today. Some rates. You need to know the rate, okay? Adults should be between 12 to 20 per minute. Children are a little bit faster, 16 to 25, and infants are even more. They're 30 to 50 breaths per minute. We check to see if someone's breathing normal, like regular and calmly. If I'm doing this, what am I probably doing? Hyperventilating. That's not normal, right? Or if I'm breathing too slow, that's not normal. We're going to talk about sounds when I get to the apical part, okay? Well, I guess I'll do it now because it's in here. So dyspnea means I'm having difficulty breathing. Dyspnea. We're going to go over more of these medical terms when we get into medical terminology in the coming weeks. Apnea means I don't have any breathing during that time. Some people go through the night and they don't breathe. So those are apnea periods. Tachypnea, I'm breathing too fast. Bradypnea, I'm breathing too slow. Orthopnea, I can't breathe when I sit up. Cheyne-Stokes is a sound that they make. Rales is another sound that they make. You all know what wheezing is. You've all heard wheezing when someone wheezes? Yeah? And then cyanosis means I'm turning blue. I'm not breathing at all, am I? Okay. So we're going to go over more of those when we get into medical terminology, but at least so you've heard the idea. Key points. So we usually can control our breathing, can't we? So our breathing is voluntary and involuntary because my body will just naturally do it. I don't have to think about taking a breath every second of the day. But if I also tell my brain, hey, I want to breathe deep or breathe low, it'll do that, won't it? So generally we can control it. So if you tell a patient you're checking their breathing, will they change it? Yeah. So how many of you go to the doctor and they take your temperature and your pulse? Have they ever told you they're counting your breaths? No. But they are. 100% of the time. They're counting how many breaths you're taking a minute while they're talking to you, and you would never even know it. That's because they don't want you to alter your breathing when they're doing that. So we're going to do the same thing when we check our patients. So we don't tell them. A lot of times what we do is when we're checking their pulse, they kind of put it across your arm or across your chest like this. They're counting your breathing then, not just your pulse. They're doing both at the same time. So this is kind of what it looks like. This old lady, right? It's a picture from your book. Super old. Maybe. I think that's all I wanted to know. Yeah, that's all I told you. So we are going to do an activity where you're going to have to get up. You're going to have to do some things. Okay? You guys even awake to do that? Or
Yeah.
maybe? Okay, so let me show you a couple things. And we'll go from there. So temperature, if you're going to do, one of the stations will have this old school, I call it old school, but you don't see these too often, thermometer. There's a button on it that turns it on, and you can see the numbers come on. The button also turns it off. Now these papers are how we are going to put them on. So it literally says number 1, insert on this side, and then number 2, peel. So what you do is you just put it in through where it says insert, These are old, so let's see if they work. And then number 2, it peels back. Kind of hard to do up in the air. It's not going to work for me standing here. But they basically just slide right in, and sometimes you can even peel them off this way. There we go. And like the paper goes on, this is the part that goes into their mouth, and you change this every single time you put a new patient on, right? Okay, so everybody, if you struggle with these, I can help you with them because they're not the easiest things. These other ones, they are, you pull this out and then you push it into a plastic tube. Okay, the plastic tube is the cover, and when you're done with it, because you change these each patient, you push this gray button at the top and it shoots off, and you put them in the trash because I don't want to be picking up your slimy plastic covers that have been in your mouth. And then when you're done, you put it back in the hole so it stays charged. Yeah? Everybody's good? And then how do we take a temperature? Under the tongue.
Or in your butt.
Or in your butt, but we're not going to do butts today.
Or under your armpit.
We're not going to do butts today. We're only going to do our mouth, which is our oral.
Are you done fitting there, buddy?
I am. So,